Good morning, everyone. Today, we are privileged to have one of our very eminent speakers among us, Dr. Ashwath Hegde ji. And, you know, he is an excellent person, very good at heart, very soft spoken, but well skilled. And he's the one who can motivate you to take a right path in your life. So, we have a very excellent speaker with us today who is founder of Some Yoga Nature Cure Clinic, CRC, as well as he is also working as consultant at Veda Wellness Center, Nisargamane, Sirsi. He is also lecturer at Siddhapura Institute of Naturopathy and Yogic Sciences. He expertise in stress management, career analysis, and behavioral counseling. He has treated more than 10,000 people in India, in USA. He had been in USA and also in St. Lucia, which is in West Indies. He has counseled more than 1,000 people in India and abroad through online and offline mode. So, what I mean to say that we have a person who can guide you all around in a very structured way. He can guide you what you can do in your life, especially post BNYS. You may be having a lot of questions in your mind. So let us answer those questions today in today's session. And I know Dr. Ashwath will be justifying his presence with his precious guidance to you all. And even you can get a lot of answers for your present issues. Whatever you have, you can ask at the end. So without sparing much time on that, let's welcome our today's eminent speaker and guest speaker, Dr. Ashwath Hegde. Over to you, Dr. Ashwath. Thank you for
Thank
joining.
you. Thank you, Dr. Vivekji. Uh, it's pleasure coming to this session and speaking. First of all, I do remember that was the first time when I met Vivek sir. So we were in college, I think second year or third year. He had come to demonstrate something new in yoga. Then we were like, we have been doing yoga for 2, 3 years. What new he could present. Uh, that time it's like more of a Kupa Manduka. Kupa Manduka means a frog in the well. We think that's the word. Then he had showed something new in yoga, like some variations of Surya Namaskara, some new variations of asanas, and also Zumba and other techniques of exercising your body. Then you're like, oh my God, this also present. There is something new outside of SDM College or BNYS. Then since then we have that was a very important point where we started learning different. We started learning something new apart from what we learned in college. So thank you, Vivek ji, for that. And Arogya Mandir is conducting a beautiful program like this. This is very very much needed for BNYs because most of this are not taught in college, right? So now we have people in this. I want to understand the crowd, like how many of you are doing BNYs, how many of you are students, and how many of you are intern, and how many of you are practicing naturopaths, either personally or in any institution. Can you just put in a chat box, student or a clinician or whatever you're doing? Just put in the chat box. I finally a student. Yes, Dharun Raj. Thank you. Just put in the chat box. I want all of your participation today because I don't feel like I'm the only one who is talking and you guys are eating breakfast and just keeping it aside. Intern, final year student, final year, intern. Okay, okay. BNY students, intern. PG scholar, Shruti. Okay, intern. Okay, I think most of your students. I can see that. Okay, more inputs. Intern. Got it. Okay, so I think we have a student crowd today, right? which is exactly I want. Okay, this is what uh, is the most important stage that you decide your. Let me share my screen. Okay, is my screen visible? Okay, let me share. Is my screen visible, sir?
Yes, it is visible.
Okay. What next? The big question we all have. So this is my introduction, which has been done already. Okay. So this is one of my unforgettable moments meeting with Narendra Modi ji. I'll tell you the story at the end. Okay. This is Alumni Excellence Award by our Dr. D. Virendra Hegde ji. These are all the online classes we conduct. And we also have a trust called Samyoga Seva Trust. Dr. Akshay, I mean, to be doctor, is doing his PhD. He's our co-founder. We are doing a lot of social service through our trust. Okay. Now, we have two parts in our presentation today. First, I'll explain diabetes reversal, what we are doing, how we are doing, why it is important. Okay. And then second, we will discuss about the career options. I'll explain what I did and why I did. Maybe that will resonate with you. That will guide you to do what you want to do in the future. Okay. Now, first of all, diabetes. What do we know? Now, from a patient's perspective, high sugar levels is diabetes, right? Because of multiple reasons. And you should do walking diet and medicines, right? Now, why diabetes reversal is necessary if everything is going right? Because even after the medicines, walking diet, whatever patient is doing, every 6 seconds, a person dies of diabetes complications. And kidney failure and blindness majorly caused by diabetes. Diabetes is the leading cause, okay? And every day, 275 people losing their toes, feet, and leg because of diabetes. In India, this is 2019 data actually. 7.7 crore people are suffering with diabetes, and 2.5 crore people are suffering with pre-diabetes. And once a person is detected with diabetes, he has to spend 19 lakh rupees in India on an average. Okay. And you see, okay, this is a better graph. The first top line shows those who took only medicine, and the second line shows those who took medicine and insulin together. Okay, either you take medicine or medicine along with insulin, diabetes is going to be very, very progressive. Okay, you see, this is the time, this is HbA1c level. HbA1c level is going on increasing. This is how medicines are getting added to the patient. First, they'll start with metformin, and one more medicine like sulfonylurea, DPP-4 inhibitor, whatever. Then, if that doesn't work, they will add one more group of medicine, and then finally insulin. And what are the complications? I'm sure all of you know these, but still, just as a refresh, recall, or revision, whatever you call. Microvascular complication, that's nephropathy, polyneuropathy, and retinopathy. Someone's mic is unmute. Kindly mute. Rohan Chaudhary. Nephropathy, that's a damage in the kidneys, and neuropathy symptoms, right? And eventually gangrene might happen. And macrovascular complications, those are stroke and heart attack. If the large blood vessels are getting affected, it might lead to heart attack. Remember, Diabetes is one of the major causes of heart attack. Okay, because if um, if out of 10 people, one person is getting heart attack, if he is diabetic, his chances of getting heart attack is 4 times more. So if a person has diabetes, he might get heart attack 4 times more than a normal person. And this increased to 10 folds, 10 times if he also has hypercholesterolemia and hypertension. Okay. And stroke. Stroke can also be caused by diabetes. So diabetes is a silent killer. See, as a doctor, a patient is your market. Okay. Now, I'm sure um, you all are going to be doctors, right? So, what do doctors expect? Doctors expect a patient to come. In a way, doctors expect people to fall sick. Is it a good thing? No, it is not, right? So, what do? We try to heal the people who are already deceased. We try to make people don't go in a path of disease, or at least we try to serve people in a better way so that they can take care of the health before they fall sick. That is what yoga naturopathy is it's important in that aspect. Okay. Now, if a person falls, he feels injury or he feels the pain, then he goes to doctor, right? But diabetes is not like that. If a person is having some symptoms of retinopathy, by the time he meets a doctor, 50% of the eye has gone. Okay, his vision can be restored only 50%. Same thing with neuropathy, same thing with cardiac condition, right? So the awareness is very less. And because awareness is less, and because there are so many people are having diabetes, diabetes is one of the major areas where we can expertise in. Now, awareness is coming, naturopathy and yoga system is booming. People are turning towards alternate system of medicine, especially after this COVID timings, right? Because of all of that, out of 7.7 crore people, don't you think you can get 50 people every month to treat diabetes? This is very much possible. Wherever you are in the world, people are suffering with diabetes, hypertension, asthma. There are many lifestyle diseases you can treat on. Only thing, you need to be confident, you need to be convincing, and you need to show results. Only then it is possible. So there are some testimonials. These are our first batch people. Right now we completed 6 batches so far. There are more than 100 people who joined. There are more than 50 people who stopped their medicine and still continuing their healthy journey. Okay. So yeah, Geetanjali Prasanna, she was taking 2 medicines. She stopped. See, her HbA1c level reduced from 7.4 to 6.5 in 3 months. Okay, and it reduced even further after 3 months. Parmesh Kumar, his HbA1c also reduced and medicines stopped, and still now he is continuing without medicine. Srinath. Srinath, he is 60 years old. Okay, so age doesn't matter, even though you are 60 years or 55 years. Of course, age matters. How the more older you are, the less possibility that you can stop medicine. Okay. However, if you try enough, there is a possibility that you can stop the medicine only when HbA1c comes to normal. Okay. Devi Srinath, she also stopped medicine. So all these people, see, Rajkumar Nayak, he also stopped medicine, 8.4 to 6.1 HbA1c in just 3 months. Okay. So all these people, how did they do it? Because we try to connect them to their problems and we showed them there is a solution to it. Problem is not diabetes, guys. Diabetes is just an underlying thing. What they feel, what they go through in their life is an actual problem. Okay, because diabetes is not pain, because diabetes doesn't feel most of the time, people are not aware of it. But still, we can make them aware by connecting them to their problem. Okay, now people say, I'm walking, dieting, taking medication, but still diabetes is not under control. Why? Whenever I go to doctor, he gives one medicine. The next time he gives some other medicine, and he keeps changing it. Why? Dietary changes. Some people say keto diet is good. Some people say you should not take sugar. You can take jaggery. Then there is lot of confusion in the diabetic diet. Risk of complication. And people like doctors, when they talk, you should control your diabetes, otherwise your eyes will be damaged, your nose will be damaged. But who is saying what they should be doing? Nobody is saying what can help them to prevent the complication, right? And diabetic people are more prone to depression. That's a recent research, okay? And they're they try things very superficially, and when that doesn't work, they just give up. They don't give enough effort because they don't have a mentor to do it. And foot care, diabetic people, they never walk barefoot. If they seen somebody having gangrene and amputation, they will never they will never leave the house without shoes. All these are the problems actually they are facing. It's not just the sugar level. If you just say you should reduce sugar level, it doesn't resonate with them. When you connect them to their actual problems, they will start resonating with you and they might listen to you. Okay? If you tell all this information to 10 people, no, say 100 people, out of 100 people, one or maximum three people might join your program. Okay, because people don't want to take responsibility of their health. So if there are 7 crore people in India, out of 7 crore people, only 1 crore people are not 7 70 lakh people. Yeah, I think 70 lakh people is a 1%, right? No, 7 lakh people. 7 lakh people are self-motivated. They want to do something. Don't you think that's more than enough for you to have a good career, right? So people have all these questions. My glucose levels are in control. Why to join this program? Because complications will occur if you don't reverse diabetes. See, for normal people, we call reversing diabetes. But for medical terms, we can't call reversing diabetes. We can call it as remission. Okay. But anyway, you can use this diabetes reversal in common public speaking. Okay. So why to join this program? Because only when you reverse diabetes, you can prevent complication. Otherwise, if you don't reverse diabetes, 100% one or the other complication will happen. Okay, eventually you will have to take more medicine and insulin, and even after that, you can't be sure that your complications will not occur. Okay, will I be able to get rid of my medication? Is diabetes curable? My parents and grandparents have diabetes. How much I am susceptible? How to prevent complication? All these questions, if they when they have already in mind, if you answer beforehand, they will be much interested in what you're going to offer. Okay. Now, what is diabetes? Everybody knows high sugar level is diabetes, right? Insulin, how insulin is getting attached to insulin receptor and how glucose channels opens up. All these, type 1, type 2 diabetes, what are the reasons? Now, coming to an important thing, most of the people think diabetes is genetic. We can say only 20 to 30% is genetic. Other 70 to 80% is your responsibility. It's like having a bullet in the gun. Only if you trigger, the bullet will shoot, right? Right. You know the reasons and everything. Now, we think the small mistakes are okay. When we were in college, naturopathy people going and sitting in hotels and eating a lot of junk food. Okay. Now, we think we have age, we can digest, nothing will happen. This is okay, this small thing is okay. Now, if we don't understand ourselves, these small little mistakes can cause a big harm. Then how can you convince the people on the other side of the table, right? So eating late is okay. Coming home and having snacks is okay. It's okay to drink 1 cup of tea. Sleeping late is okay. Stress is very normal, you know. I walk 30 minutes. I think that's enough exercise. These are the diabetic people are thinking like this, okay? And avoid rice. I eat chapati. Guys, I'm not saying these are why these are wrong because I want all of you to find out why these things are wrong, okay? Sugar and jaggery. I mean, I can replace the sugar with jaggery. Okay. Once in a while, eating outside is okay, no, right? When I eat junk, I will burn the extra calories by exercise. I take bindi water, bitter gourd juice. It's okay. Okay. Now, this is a question for all the BNY students. I do side bending asanas to reduce diabetes. Can you list out asanas that are effective in diabetes? And tell me why. Vakrasana. Okay. Ardha Matsyendrasana. Yeah, everybody is saying Ardha Matsyendrasana, Ardha Matsyendrasana. Mandukasana, Markatasana. Okay. Can you guys tell me why it is effective? Maybe you can unmute and tell me. I don't know if that will cause a lot of noise. Stimulates pancreas. Okay, Tanushri. Stimulates pancreas and do what? How does it stimulate pancreas? Improves the circulation to that particular organ. Okay. So we have pancreas, stomach. Okay. Then what happens? By increasing the glucose uptake. How? How, Bhavana? Okay. Insulin. See, commonly what we think or what we thought, we thought bending towards my left side, where my pancreas is present, we can squeeze the pancreas and pancreas will release the insulin to bloodstream, and that's how my blood sugar is controlled. So we always prescribe side bending asanas, twisting asanas, which stimulate the pancreas. Now tell me guys, don't you think pancreas can also secrete glucagon? Glucagon is a hormone which increases the glucose, right? Now, how pancreas will decide which hormone I should secrete, glucagon or insulin? Have you ever thought about it? Yes, stimulates the glucose receptors like GLUT4. Very good, Geeta. I like that. So GLUT4 is present in your muscles, guys. Why do you have to twist your stomach for it? Okay, think about it. Read about it, guys. Don't just go in a uh, very non-medical language. Okay, when you talk to some doctors, especially, it's dependent on stress and relaxation level of individuals. Okay, okay, that's also a good thing. Leela Ram. See, yoga should not be treated as exercise. Okay, there's a huge role of yoga in diabetes. It reduces stress, it reduces cortisol, it reduces oxidative stress, it brings relaxation response. All of that Please read on. It's not going to twist pancreas and squeeze insulin out. Okay, that's very, very wrong. I mean, at least we were thinking like that. From now onwards, please don't think like that. Any hormone release needs a physiological stimulation or a chemical reaction in the body that causes that secretion, not a physical twisting movement. Of course, it increases blood circulation and everything to that area. That will help. But as somebody said, GLUT4, right? GLUT4 present in all the muscles. So you need to work your muscles out. That will help. Okay. Yoga helps in a very different way. That's by reducing oxidative stress, reducing the mental stress, parasympathetic dominance, um, all of that you can speak on. Okay. Then, okay, now let's take one more example. Now imagine I am having diabetes. Okay, my pancreas is not working. Say I have type 1 diabetes. Okay, just give me a second. Yeah, I have type 1 diabetes. Now I check my blood sugar, which says that I have 100 milligram per deciliter, my sugar level. Okay, now I take 1 teaspoon of sugar, maybe direct sugar, or maybe I take as a tea or something, maybe one sweet where it has 1 spoon of sugar. After 15 minutes, I check my blood sugar. How much it will show? What's my reading after 15 minutes of taking 1 spoon of sugar? Give a try. Just random numbers. Try. My sugar level is 100. I take 1 spoon of sugar, and after 15 minutes, I check what would be my sugar level. If I have type 1 diabetes, means my, say, pancreas is not working. Okay, all right. So see, let's do some calculation. 1 teaspoon is 5 grams, that's 5000 mg, right? I have 5 liters of blood, that is 5000 ml. It will increase maybe by 50. Okay, Leela Ram. Let's see, Leela. I mean, Leela Ram. So 50 deciliters. Deciliter means 100 ml, right? So 5000 mg in 50 deciliter. That is 100 mg per deciliter. So it will increase by 100. So after 15 minutes, if I check my blood sugar, it will be 200 if my pancreas is not working. Okay. So why I'm saying this is because we think small things, small mistakes don't matter. They do matter. Okay. If type 1 diabetes, it will increase by 200. If type 2 diabetes, maybe little bit insulin secretes and it will come down a little lesser. But type 2, as time passes, it will become type 1. Your pancreas will be exhausted because of insulin resistance. It's keep on producing insulin, and one day it is tired and it produces no more insulin. Okay. All right. So what is diabetes reversal? So see, is diabetes reversal possible? By improving the beta cell function, I'm sure you know what is beta cell, right? Hepatic insulin sensitivity, we can reverse type 2 diabetes. I'm not saying this. This is published in a very prestigious journal. Now, this is one of the most important papers all of you should read. Okay. So, published in Lancet. When a patient goes to a medical practitioner, primary care physician, if he's diagnosed with type 2 diabetes for the first time, the doctor's responsibility is to tell the patient that you change the lifestyle, you improve your exercise, reduce the stress, and reverse or try for type 2 diabetes remission. This is a goal of the primary care physician for conventional practice. Now, how many primary care physicians they do it? And even if they do they have time to do it? Do patients listen to them? Do patients have the mentality to listen to them? If if their primary care physician tells it, patients do listen. So, if primary care physicians are not telling, then what we should be doing? We should be telling the public. We should be telling how it is reversible, how it is preventable, how we can live a life free of drugs in in spite of having diabetes. Okay. See, in medical terms, once a person is named diabetic, he is diabetic for life. Okay. Now you have to make your patients aware that don't take the diabetes as a label for you. Diabetes is just a condition which is present within you. Okay. We can have a reversal, and after reversal, you just keep checking once in every 6 months. If it increases, we can change the lifestyle even more. Okay. If it doesn't increase, just checking is not a problem. Most of the time, people don't check because they're scared. It is like, I'm closing my eyes. If I close my eyes, can I overcome the threat? Can I solve the problem? No, right? So we should make the people aware about it. And a bariatric surgery showed a reversal, a calorie restriction showed reversal, um, weight management program showed reversal. There are n number of research that showed diabetes reversal is possible. Okay, so what is diabetes reversal? It's called diabetes remission. Okay, HbA1c should be less than 6.5 after stopping and tapering medicine. Now, I'm taking medicine, I follow a good lifestyle, my sugar level is 6.5 or lesser, I stop medicine, and after 2 to 3 months, I check my sugar level and I still have HbA1c lesser than 6.5, then it's called diabetes remission. Okay. Chances of reversal. See, as we see in our program, if a person shows 100% commitment, the chances of reversal is 100%. And as the commitment comes down, the chances of reversal also comes down by double. Okay. Now, what do we do in our program? As we always say, treat the root cause. Now, imagine a person has diabetes. I put them into fasting. Their sugar level comes down. Do you think that diabetes is cured? It is not. Okay. And um, I give them a keto diet. I give them a weight loss program, and insulin resistance is improved, beta cell dysfunction is improved. Do you think diabetes is reversed? Maybe not. There is there are much more deeper reasons, there are much more deeper mechanisms we need to address. And when we do that, diabetes reversal is more sustainable. So, Dr. Venugopal, who is our mentor, he treats the root cause, and we got trained under him 2 years back. And because of that, even after 1 year, 2 year, people are still able to not take medicine and manage their entire sugar levels just with diet, exercise, sleep, and stress management. Okay, so there are 4 pillars we do: diet, physical activity, sleep, and stress management. So this we do in a community basic, okay? Means we don't do it individually. We'll do it as a batch wise. In one batch, there are like say 15, 20 people, and we teach them every week what they should be doing, what they should not be doing. We give them a chart. In that chart, it will be mentioned what you should do today, tomorrow, like Sunday, Monday, Tuesday, then how much physical activity, how much yoga, how much what diet you should be practicing. We'll give them a chart and we'll do it in a very funny ways. Okay, we'll conduct some games. So we make it very interesting and we show them that everybody together can do it. And one person does it, the other person also does that. So they are committed to send 3 food plates. Every day in my WhatsApp, I'll have at least 50 food plates coming from the current batch and from the previous batch. Because once they get this habit of sending food plates, even after they complete the 3 months program, they will be keep sending. And sending food plate will make them accountable. They will be committed to what they do. Health is not with information. If information gave health, Google would be the best doctor, right? If information gave health, we could just give information and people would be healthy. No, people are not following the information. We have to change the habits of the people, and changing habit is one of the most challenging things in the entire world. You know, have you seen this Shark Tank idea bazi where people come and pitch their ideas, and there will be investors sitting and they invest in crores of rupees. So if you have seen, if an idea involves changing the habit of the people, then that's a bad idea because changing the habit of the people, which is ingrained for so many years, is the most difficult task in the market. Okay, and we can do that. It is difficult, but impossible, not impossible. It is very, very possible. Out of 100 people, 1 to 3 people will come. But that's all we need to be successful in our career. Because we don't have to have quantity, we need to have a quality. When we give quality, people come to us who are a little bit motivated. If they're 1% motivated, we can motivate them to 10%, 20%, 100%. Don't you think that's a good thing? And word of mouth publicity will happen, and you will be able to do this as well, like how we are doing. Okay. If anyone wants to pursue this diabetes reversal journey, please let me know. I can guide you and I can help you. Okay. At the end, I'll share my phone number. You can get in touch with me. So, in diabetes reversal, we'll take the questions at the end. Okay. Now let's come to the second part. What next? Okay. Why this is important? 99% of the time, this is not taught in college. Okay. Maybe you're scared at this point. Uh, some of your interns, some of your still student phase. In student phase, we are just focusing on enjoyment, and we have some vague idea what we can become. I'll take up this job, I'll just do MD, all of that. But still, see, when I started my BNYS, there were 3 colleges in Karnataka. But now there are 14 colleges in Karnataka. And same thing in the entire India as well. So I'm not scaring you, okay? But this is a fact. There are so many BNYS colleges coming up, which is a good thing. Our community should grow. As well, there is more competition, okay? There is more competition for the jobs to take up, but not jobs to create if you create yourself a job, okay? However, see, I always believed you don't have to join a number one profession. You have to make yourself number one in your profession. Now you see a general practitioner and a specialist. Who charges more? A specialist. A general practitioner and a specialist. Pe to whom people will go more. Of course, general practitioners will have multiple different types of patients. But a specialist will have one set of people who are coming to him or her, and he will see them in a regular basis, right? They are more deep workers. So, like Dr. Vivek said, we have to find our niche and work on it, and there is no limit for the scope. Okay. and you have a responsibility. Now, I feel a little bad to say this, but this is a fact. Many girls join BNYS and they do nothing after BNYS. Many of them. If you are not one of them, don't take it for you. Okay? So you do have a responsibility. Okay, you study 5.5 years and become a doctor. You get married and you settle. Are you applying the knowledge what you have in your family? Ask yourself. Are you applying the knowledge what you got in your circle, friend circle, family circle? Are you able to apply your knowledge and earn something by putting it into practice in the society? That's a responsibility, isn't it? If you know something and not do it, and it's equal to not knowing it, correct? And my work here is to channelize your fear to work on things that matter. Okay? So when we have clarity about the options, that's heaven. Otherwise, it's hell. So in my counseling, I always say confusion is hell and clarity is heaven. You imagine a terrorist who is who wants to blow himself to kill some people. Okay, do you think he is in heaven or hell? Even before he dies, he is in heaven because he has very good clarity that he has to do this only, and why he is doing it. He is very clear. Okay, that's heaven. What's the effect of it? It's secondary, but clarity is always heaven. Have clarity about your options. Make an informed decision. Okay, and know your strengths. What is success and what is satisfaction? What is success and satisfaction? Are the same or different? What do you think? You can put in the chat box if you want. Do success and satisfaction related to each other? They are different. Yes, they are definitely different, actually. Yes. Success is what other people see you as. Satisfaction is what you see yourself as. Okay. Now, I can train a cheetah to swim. It can work very hard, it can swim, but the strength of a cheetah lies in running, right? It may be a cliche example, but still it matters. So find out your strength, okay? And planning next step. Just knowing what your strength is not enough. How do you execute your next steps? And are you knowing all the new opportunities? Or are you just stuck with the conventional options only and preventing long-term dissatisfaction? Right place, right job, right people to work with, right hospital, a right mentor, most important. When you have all of this, when you have a intention to think all of this, only then you will discover the best career which suits you. Okay. Now, next 5 minutes, maybe 10 minutes, I'll explain my journey, why I did what I did. Okay. Maybe that's relatable to you, maybe that will help you because my experience can be a guide to somebody. So, first, I want you to know what are my values. Likewise, I want you to understand what are your values, that those things which you cannot compromise. If you don't know what are your values, or if you don't know what you want, and if you don't know what you don't want, then you will go anywhere, everywhere, and do anything, and finally doing nothing. If you don't have a dream, people will use you to fulfill their dreams. If it is okay with you, it's absolutely fine. But do you have a dream? Do you have a goal? Do you have a clarity in the mind that what you want? Do you have a clarity in the mind what you don't want or as well? Okay. Now you see. First of all, I joined naturopathy because Here I can take care of my health. Okay. And I don't want a job that is very, very stressful. When I was in PUC, my maths was very good and I liked maths very much. Biology was okay, okay. But my passion was to serve people. And my passion was to take care of my health. My passion was to make other people healthy. So that is why I chose naturopathy in spite of having a very good marks in I could join MBBS or I could join um, engineering, which was very popular then, even now. Okay. But I joined naturopathy because my value system did not agree with those other options. Okay. I should be able to do my duties as a son, husband, father, and you can relate it to your life as well. See, work is just work. Life should not be full of work which you don't like, right? Work is just a small part of life, and the other big part is your personal life and your family life. If you want to take care of yourself and your family really well, then you should spend enough time. You should be able to um, be with them if that's an option, right? And that is possible only when you have that as a priority in the mind. See, tomorrow something happens, I can change my job and maybe I can go to university and study something else and I can become something different entirely, right? But can I change my body? Can I change my mind? Can I change my family? Not possible, right? So that's what is more important, at least for me, okay? Not settling in any metropolitan cities. I can work there for some time, short time, but I don't want to settle in Bangalore, Chennai, Hyderabad, Mumbai, Delhi, Kolkata, like these metropolitan cities. I don't want to work there. If you want to work there, it's your choice. This is what was my choice. Because of the traffic, because of the pollution, because of the hurry-burry lifestyle, um, I don't like. That's my value, okay? I'm not putting it on you. Living close to nature. Once again, it's my value, okay? And a happy patient and sadhaka. I want patient or the sadhaka to be happy. I mean, I want to treat them well. Practicing naturopathy and yoga. I want to practice naturopathy and yoga after becoming naturopathy and yoga practitioner. A lot of people they do duties in allopathy hospital. I mean, with all due respect, that's not what I want to do. Okay. And I want to make enough money to have financial freedom. Finally, we do jobs to have financial support, right? And I always considered mental health is much more important than physical health. And a good mental health will lead to physical health. Okay. Even though physical health is important, even though there are many physical ways to get mental health and serving society. Of course, this is one of the major values which I had, still I have. Okay. So because of all these values, I did what I did. First, I'm sure you know this person, Dr. Naveen KV. Okay, he's one of the pioneers in yoga research. So soon after completing my internship, Dr. Apar Soji, who is a principal of SVASA right now. Okay, so he suggested to join Dr. Naveen KV because I may not earn so much there, but the experience what I get is invaluable. Trust me, guys, there is nothing greater than having your own experience with somebody like Dr. Naveen KV. Okay, if you get a chance to work with any great people, great healers, or researcher, whichever area you want to focus on, please do go there. Experience at least 6 months, 1 year, whichever is possible, and as early as possible. Okay. And I was there for almost an year. Okay. Salary was okay, okay. Bangalore lifestyle, I couldn't save much. Okay. And my whole intention was not to get high salary, but to get very good experience and learning from him. And trust me, even today, his teachings, the time I spent, what I learned in that clinic, it do matter. Okay. And When experience is with you, it's much more than a degree. Okay, so that's Yogakshema. Then, because I'm from a very middle class family, I had a student loan to pay, and with the income what I got from Yogakshema, I could not pay it. Okay, that's why I wanted to plan something else. Then, cruise. In 2015, 2016, okay, cruise was not a popular option then. Okay. There were few people who went to cruise like almost 8, 9 years back. They were in cruise, but there was a gap. There were not so many naturopathy people who went to cruise then. Then Dr. Shakti Vijayan, I can proudly and happily say he is one of my close peoples. Okay. Uh, he is one of my mentors, whatever it is, even this presentation for that matter. I had asked him what are the points I should include and what should not tell students. Okay, so he guided me, why don't you go to cruise? Then I said, I want to live close with nature. I want to practice naturopathy. Cruise is what? Just acupuncture. I don't want to do it. No, listen, at this point, money is important to you. Okay, and one of the fastest ways to make money is going to cruise, and that's the best option you have. So why don't you spend seven 7 to 8 months in cruise instead of spending a lot of time in other jobs? Just repay your loan, then you can happily go with all your values. So you have to compromise your values to some extent at some point of the time. That's okay. But always have back of your mind that this is not my value. Okay, that's a fast-paced life. People come that you see only once in your lifetime. So 3 days, 5 days, 7 days cruise, you just see them and you will never see them again in your life. But still you can make some impact. So for my satisfaction, I was taking yoga class in the cruise. I was teaching them naturopathy. I was doing diet classes. I was all the patients, I mean not patients, the um, what travelers. I used to teach them yoga and other stuff as well for my satisfaction without charging them anything. Okay, but why did I go to cruise? Because to repay my loan, and once I repay, I did not go back. Okay, now now the choices, now the competition is very high to go to cruise. Um, but anyway, if you want to live the life of the cruise, then that's an option as well. Okay. Then after the cruise, I came back, started freelancing. Okay, what next? I don't want to go back to cruise because that's not in my value system. Okay, the purpose is done. I had enough money to repay my loan. Now coming back, what next? And I started freelancing while thinking. Um, because you'll have to you'll have to keep your practice. If you lose your practice, then what happens? You lose the touch and you might not do it, right? So I started doing acupuncture, yoga classes, offline in the localities. Okay. Then I got married to Dr. Kirti. Then she also had a job in STM college. So she left the job. I left the job. So two jobless people got married. Then we started thinking what we should do next. Then we started some yoga clinic in Shirsi. So Shirsi is a naturopathy hub. We have three big hospitals, Dr. Venkatraman Hegde, Dr. Jitesh, Dr. Lakshmi, Dr. Praveen Jacob. They have huge, huge hospitals. And we started clinic as an outpatient department. So why did we do this? This was the seed. This was the seed to realize our dreams, what we had, okay, in 2018. And meanwhile, we were also working as a consultant and part-time practitioner in Veda Wellness Center because running an OPD successfully needs time. It takes time. Okay, that time um, we were having quite a good number of patients. Okay, but Even then, we had one more stream of income that was from Veda Wellness Center, Nisargamane, Shirsi. So always remember, try to have multiple sources of income. This is a financial advice from me. Okay. Always try to have multiple sources of income. Even though it is few thousands, it's okay. It does matter in the future. Okay. So Veda Wellness Center, Dr. Venkatam Hegde, he is the first person with whom I spoke before I joined naturopathy. He's the person who um, inspired me, motivated me to do naturopathy, and still he is supporting. Still, I work as a consultant there. He offered us a job. He offered us a full-time job for myself and Kirti, both. See, it felt like, okay, life is settled. This is a huge hospital. We both can work here, which is close to home. I can stay home. I can work here, get enough uh, salary. I don't have to worry about bringing patients, treating them, results, nothing. You just work, fine, it's close to home. What else you need? We did have other dreams. And to fulfill those dreams, to fulfill those values, we couldn't be committed to one place. If we committed there, 9 to 5 time is gone. And we wouldn't be practicing alone. We wouldn't be able to come out and teach people, educate people. That's what we wanted to do, right? So we did not join there as a full time. We were never committed to any place full time. Then comes mental health. One fine day, Dr. Uh, Venkatram Hegde told, you talk to that patient, he is little bit disturbed. And I spoke to that patient, and he spoke about 1.5 to 2 hours. Okay. Then I said, sir, I can't do this for free. I'll do this as a counseling. Okay. By then, when I was in Bangalore, when I was freelancing, I did multiple courses on mental health. As I told, mental health is much more important than physical health, according to my value. So I joined NLP, I joined hypnotherapy, I joined multiple other courses where counseling, different therapies, CBT is taught, like small 5 day, 7 day courses, okay, online and offline both. Then I started applying them, and it gave a very good result. So then I was a counselor in Veda Wellness Center, Nisargamane, Shirsi. Okay, I did not have a degree in counseling then. Okay, started counseling. Okay, because I had a passion, because my value system supported it, and because I had a good skill, not a degree, remember, a good skill, I could be I was a good counselor then. Then I thought, okay, I should have a degree. If somebody asks, then how did I tell? I can't just show this 7 day, 8 day courses as a degree, right? That's not a qualification. Then I joined Jain University for MSc Psychology and completed it as a distant degree. So since 2019 till now, I have counseled more than 1,000 uh, Indian patients, I mean Indian clients you call, and more than 200 foreign clients for mental health. Okay. So then came a turning point in 2020. Because of Corona, there was an online competition called My Life, My Yoga. Okay. Then Dr. Raghavendra Rao, who was the CCRY director, um, he told, see, by then I thought yoga is not for competition. I represented our university in multiple times, multiple years when doing BNYS. But later I thought, see, yoga is not for a competition. It shouldn't be treated as a competition. It's something internal. It's mindfulness. It's related to your mind, right? So I thought I will not participate. Then he put a message in all the groups saying, see, this is the time where BNYS people should show our strength, show our presence. So all the naturopathy people, including students and practitioners, make a video and upload. Then I thought, okay, let me also participate. While participating, okay, let me do the best what I can do. So I took 2 days of time, thought, then designed the script flow and everything, uploaded the video. Then um, it got first prize, national level first prize. Then I thought, wow, if national level first prize is there, then I could also win global prize. No, then it got global prize as well, the first prize, and I was shocked. So there are mainly two reasons for this. Okay, one, I was very, very committed to what I did. I delivered the best what I could. Okay, I'm not as flexible as so many people did in the competition. There were more than 35,000 entries there. Number two, I did visualization. Okay, visualization in such a way that I visualized Narendra Modi ji giving me prize. After doing this competition, after putting all my hard work, I wanted to put some spiritual energy there. Okay, I visualized Narendra Modi giving me prize, and eventually I could meet Narendra Modi ji as well, right? So you should work hard, you should work smart, put your 100%. Along with it, you put a little spiritual energy as well, then things will manifest. Okay, so then Saint Lucia. Sorry, I'm going beyond time. Can I take 2 more minutes, sir, before I close the session?
Please go ahead. Take your time.
Okay, okay. Thank you. So during Corona, we had no job, but still we had to pay rent. Then Sanket and Dr. Sanket, he called me. See, there is an option of going abroad. Would you like to go? Then I thought, no, we wouldn't go because we can't leave home and all. Uh, then what if both of you can go? Then I said, okay, let's think about it. Then I thought we won't go, you know. Uh, then I simply asked my parents, how about going abroad for 1 or 2 years? Then they said, if you want to go abroad, go now, not after having a kid. Then I thought, okay, yeah, this is a good opportunity to make some money when you have no money here in India. Then this will be a good source of income, and this will make you stable as well. And still you are able to practice, because in St. Lucia, that's a body holiday wellness resort. It's not just a normal resort or a fun loving place. Okay, people who seek health come over there. So we practiced naturopathy, counseling, yoga, nutrition, acupuncture, all of them. Okay, living close to the place, we did not have to travel. Okay, food, place, everything is provided with handsome salary, and they were like, please guys, you don't go. We can't find a naturopathy doctor from India. Please stay. But we wouldn't like to stay. We did not stay there because our value system always said, live in India. Okay. There were so many doctors over there. There were so many Indian people, Indian families were there. We could make a life there. Okay. It was very beautiful. It was very comfortable, but we did not stay there. But why did we go there? To stay there for 1 year, make some money, and come back. Okay. So then I joined naturopathy college. See, once again, this is one more stream of income. And also, if you teach, you'll be in touch with the basics. That's why I joined there. We also founded Samyoga Seva Trust. Through Trust, we conduct a lot of health awareness camps, free checkups, and all. Okay. Then Samyoga Sadhana Private Limited. This is a company. If if you want to make a big system, always have a company, always have a startup. Try to make a system rather than practicing everything on your own, doing everything on your own. For that, company is very, very helpful. Okay, to save some taxes as well. And Ananda Garbha, if we have to make people healthy, the root should be very, very healthy. And the source is in your belly. I am like this because the 80% reason how my mother was taking care of her health while I was in her belly. Okay, so that's why we started Ananda Garba. Dr. Kirti is an expert in that. She's a postnatal and prenatal coach. And Samyuka Student Hub, I started training students, 10th, 11th, 12th students for a better outcome in their curriculum. Okay, we teach many techniques there because what I did not get there, I am teaching them, and we are seeing very, very good results. Okay, so yeah. Api Swarnamayi Lanka Name Lakshmana Rochate Janani Janmabhumishya Swargadapi Gariyasi. So why did we come from Saint Lucia? Because we wanted to be in India, live with the family, do something for the people from whom we took something. Okay, that is my value. So our aim is to improve lifestyle of ourselves, our family, then a community and a society. So building a healthy community is our value system. Okay, so that's why we did what we did, why we did. Okay, work on realities. So my few suggestions for you. First, you should have a good knowledge, physiological knowledge, and a naturopathic knowledge of any disease, and develop a skill. See, guys, if you are giving results, people do come to you, no matter what your degree is. Okay, and for that you need to develop skill. For that you need to experience under a trained personnel. Who is that? You need to decide. And communication skill. For a naturopath and yoga physician, communication skill is utmost important. You should be able to convince your patients to take treatment, convince your patients to believe in what they are going through in your treatments, and convince your patients to change the long habits which were wrong. Okay. Then execution skills. How are you executing it? Okay. Acupuncture works. How are you going to make an acupuncture clinic? Okay, and charging properly. So are you in a tier one, tier two, tier three cities? Who are the people coming to you? How much time you are taking? What are the costs involving it? How are you going to charge? Okay, you have to learn it properly. Then do things consistently. Okay, your personality matters. I do a career counseling where our personality is analyzed. If anybody is interested, you can let me know. Okay, and keep learning every day, every time. Learn something new. More experience is always good, and your connections matter. Okay, see, I did so many things, right? For all of that, the first important factor was the connection, was the social circle which I had. Okay. Whether it was working with Dr. Venkatram Hegde, whether it was going to cruise, whether it was going to St. Lucia. Okay. There are some secondary circle, when you have a good personality, when you are good with people, when you maintain connection, when you maintain a very good social circle, that is one of the major reasons for your success in your career. Okay, please do remember this. Okay, you are very knowledgeable, you are very skillful, but you don't have a circle. How do you execute? Where do you execute? How do you know whom to ask? How do you know whom to approach? You won't. So, social circles do matter. Please consider it. Join as many courses as possible in your niche. Okay, who should do MD? According to me, only if you want to become a teacher, then you do MD. Otherwise, MD is not required if you want to practice on your own. Or maybe if you want to work under someone, if you're having an MD, you'll get a better salary. For that, you can do. But other than that, MD is not required. Do only things which takes you to your goal. As I said in the beginning, if you don't have a goal, people will use you to achieve their goal. Okay, so have a clarity in your goal. Why are you doing? What are you doing? What do you want to achieve? And why do you want to do this only? Can you do something else? See, when I wanted to do naturopathy, I have written two diaries. Why I wanted to do naturopathy? Why not Ayurveda? Why not the other thing? Why not I become president of India and serve people? That's also serving people, right? Why I wanted to do this only and not something else? If you are convinced in that, that intention, that purpose will take you longer and that will give you satisfaction. There was a building construction going on. I asked the first person, "What are you doing?" "Can't you see? Uh, uh, we are building something." Then I approached the second person. "Can't you see? We are building a temple." And I approached the third person, and he said, "We are building a beautiful place for the people to pray." Now tell me, all these three people are doing the same thing, same work. Who has the most satisfying life? Who will get up in the morning with positivity and come to work? Who will have a smile on their face? Who will have a better sleep at night? It is the third person. So have a clear intention, have a clear purpose, have your goal set. If not today, after 10 years also you can reach it only if you have a goal. If your goal is just to have some basic money and needs, maybe you can settle in small things. Okay, so that's from me. Thank you so much for listening, and I'm really sorry for taking a little longer time. Uh, these are our numbers, Dr. Ashwath K, Dr. Ashwath Hegde, and Dr. Kirti K. You can note down the number. If you want anything, you let me know. Maybe if you want guidance in diabetes reversal or career analysis, or if you want to start something on your own, like clinic, we do run online yoga. If you want to join, by the way, we have 12 doctors, yoga naturopathy doctors. Some of them are MD also, or working for us online. Okay, if you want to join something like that, you let me know. And once again, thank you, Dr. Vivek ji, for this beautiful opportunity. Uh, my heartfelt gratitude to you and Arogya Mandal and Enigma. Yes, thank you.
Thank you so much. We have the students and participants. Now you can please go ahead with your questions. So you can put your question into chat box or you can unmute and speak however you are comfortable. Please go ahead. So I like the session, the way you presented everything right from diabetes reversal to your experience sharing of your own entire journey of your BNYS career. And all the destinations you have covered in your previous years had added value to way you do your work, the way you do your things. The way you spoke today, you were very clear about everything. There was a great clarity in your thoughts. So it is really admirable. What you're doing is excellent, and great appreciation from all of us for your wonderful work, what you're doing now.
Thank you so much, sir. That means a lot.
Let's have a chat box. My comment is there. Let's get this. Thank you for making more important sessions like this, sir. We are getting confidence by every week sessions and getting new ideas and knowing that many good hearts are present and serving to the community. Thank you for it, sir. So you got
Thank you.
immediate appreciation.
Thank you, Dharun Raj.
See, people are really admiring. Okay, we have a question from
Yeah,
Ananya Singh. Good
okay,
morning,
let
sir.
me.
I want to know that there is any opportunity in government or Ayush sector for a naturopathy.
Yes, definitely it is there. It differs from government to government. I think in Karnataka government, every district hospital has yoga and naturopathy wing. Okay, you can get seats there. I mean, you can get recruited there. But once again, because it is government, the process is little longer, and you should also write some exam. I forgot the name of the exam. So you should pass in that exam, then you can get hired in government for permanent. But there are um, some short term, what you call them? They will hire only for 1 year or 2 year just for some project, you know. Like that also there are some jobs available in government or Ayush.
Great.
I think those who work in government can guide you better there.
Yes, we have people working with the government sector, so maybe they can also guide us for that. Thank you, sir.
Yeah.
So I think our community needs good upcoming doctors who understand why they have to work, what they have to work, how they have to work. These all questions must be very clear. And in today's session, you have given the glimpse of everything, how, why, and everything. I think you had covered almost everything with your words. We have a question from Tanushri. Is there scope in doing MD in nutrition? Your suggestions.
Um, I have not explored about the MD nutrition specifically. Maybe if somebody expert in nutrition, they can tell what's the difference between MD in nutrition and uh, doing MSc in clinical nutrition.
Once I had a question from a one of the student. Sir, I want to go with the sports medicine and sports medicine and sports nutrition. So whether
Yeah,
I should pursue MD in nutrition or MSc in clinical nutrition.
clinical. Okay, that I'm not really sure. It is very new to me,
Yeah.
that field. I'm sorry.
So the suggestion was that they can go ahead with the MSc nutrition because for the sports nutrition, they need to understand the details of that particular aspects. So that was the suggestion given.
Okay, okay.
We have a question from Leela Ramji. I want to work on IBS rejuvenation. Sir, can you guide me what sources should I go for better knowing?
IBS, the best course is functional medicine. I can guide you to some very good functional medicine experts and courses. Just text me in WhatsApp, I'll send you the details.
Yes. So
Sir, you
hope
want this kind of, okay, future also. Yes, thank you, Ananya.
definitely. So this functional medicine should be applied. Leela Ramji, you can just connect with Dr. Ashwath and he will guide you further with the functional medicine thing.
Yeah.
Perfect. So what a wonderful session it was. And it was had explained everything what a doctor needs, the life journey, and in his life journey the way you had expressed was actually guiding them. It was actually guiding them how to get into their life path. So we have a
Thank
question
you.
from
Thank you, sir.
Kirtika. Is MD obstetrics necessary for prenatal or postnatal in naturopathy, sir?
No, that is not necessary. You can become a prenatal and postnatal coach without having any obstetrics degree. Okay? That is not necessary.
Great.
Yeah.
We have Thanksgiving from. Thank you, sir, for your guidance. So, Diksha, yes, we have a question, Dakshita Morwal, sorry. Literally, sir, you have a good communication skills. I really appreciate to your value. This workshop made very helpful, motivated, and inspiring for us. Hopefully, you will have more sessions ahead.
Sure, definitely, sir. Anytime you call me, I'm there. For students, I'll never say no.
Thank you so much for this amazing session, sir.
Thank you. Thank you.
So with that, we come to end of today's session, and I should say that your achievements are really uncountable, but two of them which really impresses us. One, you're being honored by Adani's our Prime Minister Narendra Modi ji. That was a one of the very important moments of your life. And again, by Dr. D. Virendra Hegde ji also felicitated you. So these are two precious moments of your life which will be always important for you.
I can brag about this anytime.
Yeah. So thank you so much for sharing your valuable experience, clear
Thank you so
guidance,
much, sir.
and practical insights on your career pathways, especially after in BNYS with your life journey. Uh, your clarity on the practice, specialization, professional growth, I think it has truly motivated and inspired our participants. So we also thank all the participants for joining today's session. Um, in meanwhile, we have a question here before we end up. So, what is the duty of an internship going student for the patient and for his or her own knowledge and practical knowledge? From Anjali ji.
Duty of interns, um, caring the patient. You show genuine care to the patient. That's the most important thing. If you are genuinely caring the patient, then automatically you will do the best for the patient, isn't it? So you don't have to drag yourself to know something or treat the patient. You'll go to the patient happily. Okay. See, I always tell no matter what knowledge and skill you have, if your intention is pure, genuine, and clear, that that will bring the skill, knowledge, and application of the knowledge very easily. Okay, there are people who are very knowledgeable and skillful, but they don't have a clear intention. They may not be able to apply that knowledge and skill very nicely. Okay, so as an intern, keep learning, ask as many questions as possible to your doctor. Okay, have an open mind, be open to all the possibilities, and many a times patients only will teach you. An old patient is better than a new doctor. There is a saying, right? So be open to learn from the patients as well. So connect to them beyond uh, the medical concerns what they have, then you will have a better learning from them. Okay, and people like to take treatments uh, from the people whom they like. Okay, so make patients like you, uh, and you also like them, and that's what is going to give you a better experience in the hospital internship.
Wonderful. We have from comment from Nisha ji. Thank you, sir, for this knowledgeable session. It's really helpful for the students for their career. I have a suggestion that for in nowadays the people have more mental health related problems. So if there is a session for psychologically related importance, it will be helpful. I think that psychology counseling, what you had mentioned, how to do that, that is also a great skill, I think, the way you had been doing all these years.
Yes, sir, definitely. Anytime you let me know. I can also share there are many free workshops available in our website, like how to control the mood, mind, stress management. They are free workshops. I can share the link as well. You just text me in WhatsApp message, I'll share you. But if it can be conducted in Arogya Mandir as well from Enigma, I'm more than happy to come and give a talk.
Sure. So thank you for all the input what you have done today. It had been a wonderful session, greatly motivating the students, interns, doctors. We value your time. Thank you so much for your time, especially on Sunday, which is more of a family time. But you could spare some important minutes out of it for the community, for helping everyone. And your this gesture is really very meaningful, very appreciable. I really thank you from bottom of my heart for today's presence and for a wonderful session what you have done today. Thank you so much.
Thank you, sir. Thank you so much. Thanks, everyone. Have a nice day.